Hey, so I just saw Dr. T. You met with him earlier, correct?
Yeah,
Yeah.
I did.
So he was a patient with spinal stenosis. He had the laminectomy at through C3, C7, um, and I was just wondering what are some of the things you observed with him.
Yeah, so what I noticed was that he had just overall weakness in his muscles.
Mm-hmm.
I did notice, did you see that he had a little bit more on the left side, maybe? Upper extremity?
Yeah, I did notice a little something about maybe synergy. Yeah, flexor synergy.
Also, I saw that when he was extending back to reach onto to the wheelchair, he like had a little bit of problems with that shoulder extension range of motion. I also noticed just when he was standing, he had just a lack of balance. He needed about, I would say, moderate assistance to get up, and then minimum to contact guard when he was standing.
Mm-hmm.
Also, he did seem to have, he fatigued easily. He had low endurance. I noticed that he was anxious about falling. And also, I didn't see anybody around. I'm not sure if he has any social support. But yeah, also just like his coordination and his planning of his motor movements.
His planning, I noticed his timing was a little off just with things too, especially moving the upper extremities with that coordination. Just in general, I mean, I'm not sure how he's feeling. He seems motivated overall to get out of the clinic and everything.
Yeah, he
so
does.
that was definitely good, at least when I worked with him and everything. I don't know what you
Same.
thought, but that he fatigued very easily. So I could tell he was working really hard with his sit to stands and everything. But I mean, just in general, though, in terms of complications after the procedure, I didn't see anything really out of like the box in terms of that. I don't know if you did.
No, not really.
There were a few tests and measures I did want to do with him, though.
Yeah, same.
What do you have in mind?
Okay. For me, I definitely wanted to ask him about his pain levels.
Mm-hmm.
I want to do an occupational profile on him and just
Mm-hmm.
kind of see like his interests and values and what his goals and priorities are for therapy. Also, the COPM really just gets his perspective on how he's functioning. So I think that's important to do with him. The FIM, so we can look at his self-care, his transfers, his bladder and bowel management, cognition, and all of that sort of stuff. Manual muscle testing. I'd like to test balance, of course, coordination, and yeah. What about you?
Yeah, no, I was definitely thinking a lot of those things. I noticed he did have trouble just with initiating movement, using that momentum to get up. So I did want to do certain measures like MMT, for example, just see how strong he is. In addition to that, just when he's up, I want to see how his balance is. So I do a Berg with him. In addition to that, I just want to see how his pain levels were, get a verbal rating scale just so we can start quantifying that with him. Posture assessment before even just getting up. I need to address a few things with that. And then vitals with him just because he was post-op and everything. Reflexes, of course, neurologically. Also, muscle tightness, just things that might be preventing him from getting up in general. I was thinking, just seeing how his joints are moving in general, just different things like that. I did want to do some more functional outcome measures though, like 30 seconds sit to stand with him once you get outside of those just basic measurements and everything.
Yeah, that sounds great.
A lot of cranial nerve testing, cortical sensation, stuff like that.
Okay. So what were some impairments that you think that you saw with him overall?
Definitely balance, muscle weakness, specifically for the lower extremity. In addition to that, muscle tightness, poor posture. As you spoke to before, the coordination and planning was definitely an issue with him.
Yeah.
Muscular endurance was big with his fatigue.
Yeah.
He even
voiced it.
Yeah, he voiced it. Yeah. And then pain in general. Tenderness of the site. So things to address. What about you?
Exactly. I totally agree with that. I also just want to see. I think some of his limitations may be that he might not be able to get dressed in the morning or take a shower and bathe, getting in and out of the car, making transfers, being able to reach overhead. I'm not sure how much weight that he can carry in his hands to do grooming or to do anything like that. Just ambulating and stuff like that.
Yeah, I don't know with that the extremity we were talking about that he was having trouble using. At times he used it for support. Other times he kind of bailed out, and the more effort he used, the less he seemed to rely on it. So that was something I was wanted to investigate further with and everything. Especially since he seems to rely on it a lot, just with transfers and everything. Other functional things. Walking, I want to see how he can do. Toileting too, just with transfers and everything. Definitely want to address some things with that. I have some goals. I want to see how he is going around with a walker too. I didn't really get to see him walk too much in terms of gait and everything. So I just want to see how mobile he is and everything, and then that can relate back to just how he's able to get around his home and everything. I'm not sure how much you know about that or not.
Yeah, so I think definitely it's important for us to do like a home assessment if we are going to discharge to home, and make sure that we look at the barriers within the house. So maybe like having steps or high thresholds and just making that suitable for him.
Yeah, I'm not sure what family he has around either or anything in terms of support from that area. So I was thinking maybe an aid for him and everything. It might have to be 24-hour,
Yeah, I totally agree. But it did look like he did have some abilities as well. He was able to communicate to us his needs. He was alert and oriented. He was able to reach up onto her shoulders, which I think was a good sign. And he was able to turn his head. So he does have some things that...
Yeah, I think he was cognitively, he was there in terms of most things, in terms of being alert and oriented. It was just that motor planning that he was having issues with right now. I think that was the biggest area to address with him in terms of that, at least. He might have a fear of falling though. I was thinking. But the nice thing though is at least he does acknowledge his lack of coordination and everything, So at least in terms of that, I'd rather him acknowledge that and then be safe, try to be extra careful with what he's doing than the opposite, at least for now, you know what I mean?
He's self-aware of like his level of
so something I want to try to do is I would like to build confidence in the areas that he knows he's able to perform, and then start branching out to areas that he might not know that he's able to perform yet, and then just get him more comfortable and moving around, and then just understanding what he can and can't do. Yeah, definitely.
Yeah, there's a lot of education that we can do for him together.
Yeah. So overall, for his problem list, postural alignment, he's going to be in that wheelchair for at least a few more weeks in terms of that. In terms of getting around, just upper extremity, lower extremity range of motion,
sit to stand,
functional stuff, strengthening, sensation testing, neurological testing, screening, balance, coordination, anything else you wanted to?
And then just definitely ADLs, just making sure that he's functional, and just, I haven't really seen everything that he's able to do, but even just taking him into the cafeteria and seeing him eat and making sure that he can do functional things, and we can work on with him
definitely.
on that. So some of my goals that I had for him was I'd like to see him transfer from the wheelchair to the bed with contact guard assist. Also, I'd like to do transfers to the toilet and sit to stand, into the shower chair, and I'll get into that later with my interventions with him. I'd also like him to be able to reach his back in the shower, and so then we'll work with the extension on that.
Yeah. No, I had similar things. I didn't mean to cut you off. Is that it?
That's okay. And then also just fall prevention techniques while ambulating with assistance and energy conservation.
Yeah, I had some similar things. Mine involved more ambulation with a walker, though, definitely. I want to see how he can get around, and then my long-term goal with him is so that hopefully he can ambulate, about 300 feet, give or take, and everything on level surfaces, so he's better able to get around and just not be restricted to his home.
Yeah.
In addition to that, being able to move around in bed mobility was something I wanted to address with him, and definitely just sit to stand and just standing so that he's able to carry out ADLs that you're talking about with his upper extremity function.
So some interventions that we could both do is just educating and training him on those energy conservation techniques so that he doesn't fatigue as much. So for me, that would include just like pursed lip breathing or taking frequent rest breaks, organizing his schedule, so things like that. I also think for both of us, teaching like body mechanics and safety, fall prevention techniques, joint protection, and stuff like that.
Yeah.
Some other things that I think I could work on with him are, so we could do activities to prepare him for dressing. So just things with different adaptive equipment. He might need a reacher or whatever he may need. Also, just using activities that interest him to work on the upper extremity strengthening. So maybe like putting cans in like a pantry or something to prepare for living at home. And then also just educating him on other adaptive equipment, like such as having a shower chair and just making safe transfers to the shower, handheld shower, and just things like that.
Yeah,
How about
energy
you?
conservation was definitely something that I'd like to work on him with and everything. I had a lot of therapeutic exercise in mind for him, you know, just to work on strengthening, and then I think that'll help with just in terms of his transfers and also his just his overall balance. That'll help with the stability for him and everything. Hopefully I can progress and make things more functional for him and start getting more bringing more into play that motor planning that goes along with doing functional activities that could be related to the strengthening as well and everything.
Yeah, exactly.
And then just his general ambulation. I want to definitely work on muscular endurance with him too. Make sure he's able to get around and that he can't, just so he doesn't get too fatigued. And then if he doesn't have anywhere to go, you know, it's an issue and everything. But part of that's making him aware of what he can and can't do, as we were talking about before.
Yeah, we definitely need to check out where he's at.
Yeah, right.
For sure.
So what timeline are you thinking?
I'm thinking that we could do 5 days a week for an hour.
I think that'd
maybe.
be good. Yeah.
Okay.
Start off at least. Yeah.
I'm thinking 8 weeks
8 weeks
for the long term.
Yeah, I think that's appropriate. You know,
Yeah.
and then from there we should generally have an idea about what he's able to do, and then bring a long-term plan into that moving forward with where we think he should go, whether it be back home with an aid or an ALF, for example.
Exactly. I think that's perfect, depending on who he has around his family.
Yeah, exactly. All
Okay.
right, great.
Great.
Thanks.
Sounds good.